Hello, everybody. Hope you are doing well today. Hope you're fine. Hope you had a nice day. So, today is the 14th of November and is known as World Diabetes Day. It's a day that has been dedicated all over the world for information to go out on diabetes. So, there's a lot of sensitization going out on diabetes today. It's very important because when we have information, we can be empowered to make better choices for ourselves. So my name is Dr. Rabi Labaran Nangambo, and I'm doing this video because I'm passionate about giving information to people, to patients, to communities, health information so that we can make better choices, better and healthier choices so that we can have better lives. So I'm going to be talking about diabetes and I'm going to be giving the generalities of diabetes. I'm sure almost all of us here have heard the word diabetes, but maybe if you're asked further, like what is diabetes, how do you know if you have diabetes, or what are you supposed to do if you have diabetes, we'll probably not really know much. So I'm here to just give some information. Of course, this is not totally all the information that there is to know, but at least I'll give some information that can be helpful to us to, of course, make better life choices to either prevent or to live better if we're already diabetic. So our discussion is going to follow this outline. We're going to first of all look at what diabetes is. What's the definition of diabetes? What does it mean to be diabetic? The second thing we're going to look at is how do we get diabetes. Like, I'll explain what is the normal, then I'll explain the abnormal thing that happens for us to be or to have diabetes, for someone to have diabetes. And then I'm going to explain the risk factors, that is the things that predispose us, the things that give us a higher chance of having diabetes. And I think this is very important because the essence of giving information like this is so that we can learn how to prevent ourselves from becoming diabetic. And then I'm going to explain the signs, warning signs that you can have so that you will be able to easily notice them and go to the hospital to see your healthcare practitioner for more action to be taken. And then I'll just cite out the complications of diabetes. It's important to note that most of these chronic diseases, what we are most afraid of or what we are trying to avoid is the complications of chronic diseases like hypertension, like diabetes. So the first thing is, what is diabetes? Diabetes is a disease that is caused from the accumulation or too much sugar in our bloodstream. So normally, when there's too much sugar in your bloodstream, you're going to be said to be diabetic, or you're going to be said to have a high blood sugar. And as I said, it's a chronic disease, meaning that in the long run, if there's too much sugar in your blood and it accumulates and stays there for a long time, since diabetes is a chronic disease, in the long run you will start to have complications because there's excess sugar, more than the normal value in your blood, just sitting there for long periods of time, which will eventually cause the complications that most of us are trying to avoid, or what we do not want, neither as the patient or as the doctor, because they are very difficult to manage. So after knowing what diabetes is, now normally, I know that there is this always this adage or this thing that goes on in the catheter. Oh, don't eat a lot of sugar, you're going to have diabetes. Or if your parents see you eating a lot of sugar, they're like, don't eat a lot of sugar, you're going to have diabetes. Well, it's not very right, and it's also not very wrong. It's not the sugar that you eat that is going to give you diabetes. It's the fact that when you eat a lot of sugar, it is converted to fat, and it's the fat that's you becoming obese or overweight that is a risk factor for diabetes. Because normally, the way our bodies have been created, there's a system in your body that makes sure that the sugar that you take in, every food that you take in will be digested eventually. And when it's digested, it's converted to different things. And what we'll be looking today is glucose, that's sugar. So when you take in food, whatever it is, fat, sugars, and it's being digested, is transformed into what your body, what your cells can eat. And one of those things is glucose. So when your digestion is finished and then you have glucose now being sent to your blood, normally the body has a mechanism. The body has something, a hormone called insulin. So we are going to call insulin, we're just going to call insulin Mr. Insulin. So there's this guy called insulin. who makes sure that the sugar in your blood is transferred into your cells because your cells feed on this sugar. So normally, if you're normal, if you're not diabetic, there's a system that makes sure that no matter how much sugar you eat, it doesn't sit in your blood. From your blood is being transported into your cells. Now the person who does this transportation is insulin, the guy insulin that I said. So what insulin does is, I would like us to look at it like a key and a door. If you want to get into your house and you're outside, what you do is that you just put the key and you open the door and you can get in. So insulin is like the key that our body has made to carry sugar from your blood into your cells. So in a normal person, no matter how much sugar you eat, there's enough, your body knows how to regulate and produce enough insulin to carry those sugar from your blood into your cells. That's the normal. Now what happens for someone to be said to be diabetic is that insulin, or the hormone called insulin, there are two options. It's either it's not produced enough by your body, that means that your body can no longer produce as much insulin as is needed, like your body can no longer produce as much insulin to open the door for sugar to get into your cells. That's one option. Or the other option is that your body is actually producing the insulin, your body is actually making the key, but the door is no longer sensitive to the key. So imagine that you come one day with your key, and for some reason maybe somebody has tampered with the lock, with where you put the key in. So the lock can no longer, is no more sensitive to the key, like you put the key in but it's no longer opening the door. So there are two options. The first one is that there's something in our body that produces this insulin. So in the first case scenario, this organ has been destroyed, and then your body can no longer produce the insulin as it should. And then in the second case, your body is actually producing this insulin, it's actually producing the key, but the door is no longer sensitive to it. So now that leads us to the two types of diabetes that are there, or the two most known types. There are three most common types of diabetes that are known. There's the type 1 diabetes, there's type 2 diabetes, and there's gestational diabetes. So type 1 diabetes can happen at any age, and type 1 diabetes usually occurs, there's really no reason why type 1 diabetes occurs, but it occurs because your body fights itself. So your body is fighting the organ that produces this insulin, and so that organ is being destroyed, so it can no longer produce. Like imagine that the factory that produces maybe cement has been burnt down. So if there's just one factory that does that, there will be no longer anybody to produce cement, so there will be shortage. So that's what happens in type 1 diabetes. The person that is producing, the factory that is producing this hormone or this key, has been damaged by the body, so we can no longer have enough or sufficient. That's why when sugar is in your blood, there's nobody to open the door for the sugar to enter into cells, so the sugar sits in your blood, and then you'll be said to have a high blood sugar. That's type 1 diabetes. It occurs in any age, and as I said, there's really no reason why this usually happens. So type 1 diabetes is really not very preventable per se. Now we'll go to type 2 diabetes. Type 2 diabetes is usually the one where your body is fine, it's producing your insulin, it's producing the key very well, but now the key is no longer sensitive to the door. That means when you put the key, the cells are like, no, this is not the key, we want another key. So the door will still not open, and so the sugar is going to sit in your bloodstream instead. So that's type 2 diabetes. And then there's another type which I'll just mention in passing, which is gestational diabetes, and it occurs when a woman is pregnant. She's normally not diabetic, but because she's pregnant, she can have high blood sugar, like sugar can be high in her blood. Okay, now I would like to talk about the risk factors of diabetes. Type 1 diabetes really doesn't have, there's not much that we can do to prevent, so I'm going to focus on type 2 diabetes. Type 2 diabetes, usually the risk factors, one of the major, or like the highest risk factor of type 2 diabetes is obesity. As I earlier explained, in type 2 diabetes, your body is producing the insulin normally, but the door is no longer sensitive to the key. So one of the highest things that makes your cells not to be sensitive to insulin, or to the key as we call it, is fat cells, obesity. When you have fat just lying around your cells, fat kind of make your cells not to be sensitive. Let's say, for example, if you have a phone that you put maybe your face ID or your thumb ID, and there's some kind of virus in your phone, or somebody has tampered with something in your phone, you come and you put your thumb ID or your face, and your phone no longer recognizes your face, your phone is not going to open. So that's the same thing that happens in type 2 diabetes. When we are obese, there's a lot of fat just lying around your cells, and fats can be considered like those viruses that make your phone not to be able to recognize your face anymore. So the insulin is there. The insulin goes to cells that open up. We want to send in sugar to you, and your cells are like, no, this is not the key. We want something else, because fats kind of make the cells insensitive to insulin. That's why the highest way to prevent diabetes, type 2 diabetes, is would turn mostly around not being obese. So one of the highest risk factors of type 2 diabetes is obesity. That's why on under risk factors you have things like inactivity, because when you're inactive you can easily put on weight, become obese, or become overweight. The next thing is diet. If you eat healthy, you're not going to accumulate a lot of weight. So most of the risk factors for type 2 diabetes will turn around things that will prevent you from being obese. So the risk factors are obesity, inactivity, poor dieting, and then there's alcohol consumption, excessive alcohol consumption. I know that in Cameroon a lot of people consume alcohol, but it's alcohol, but it's a risk factor because it causes a lot of abdominal fat, like it causes a lot of fat around your abdomen. Obesity, abdominal obesity, alcohol is going to cause you to have abdominal obesity. And then there's the famous smoking, which is a risk factor for every bad thing. So there's smoking, there's alcohol, there's inactivity, there's poor dieting, and then there's also a family history, first degree family history. If your mom or your dad or your sibling is diabetic, you have a higher chance. But now if you have a higher chance, it just means you have to be more careful. So how do we prevent diabetes? In the prevention of type 2 diabetes, you just have to turn around the risk factors. What do you do to prevent? But of course, there are people who are not obese that have type 2 diabetes. But one of the major ways to prevent type 2 diabetes is to make sure that you're not overweight or you're not obese. So you eat healthy, you eat a lot of vegetables, a lot of fruits, diets that will not make you to accumulate a lot of fat. And then you become active, go to the gym, do some exercise to keep your weight within the normal range for your height. If you're smoking, you have to quit smoking. If you're drinking a lot of alcohol, of course you have to reduce your alcohol intake. Now, what are the warning signs that you're going to have? What are some of those things that when you start to feel them, you should think that, oh, I need to go to the hospital? First of all, what I want us to remember is that, like most chronic diseases, diabetes does not have symptoms. It's asymptomatic at the beginning. That means you're not going to have symptoms. You're going to be fine, but your blood sugar is going to be high, because usually what we are more afraid of with chronic diseases is not the disease itself, but it's the complications. And the complications come because it has stayed like that in a long time. Chronic means a long period of time. So usually you're not going to have symptoms. So if you're waiting for symptoms, you might have symptoms only when there's already trouble, like your body is signaling that something is really really wrong here. So usually the advice is that just go to the hospital for intervals to check your blood sugar and to know, so that if it's that you're pre-diabetic, that's just before diabetes, you can start to put in these lifestyle modifications to bring about these changes. So now if you're having these symptoms, meaning that you're already almost at complication, this is what you're going to notice. Most people will notice that they'll pee a lot, as the frequency of your urination is going to increase greatly. You're going to go to the toilet a lot, and usually most patients have the feeling that they go to the toilet a lot at night. Usually you pee a lot during the day and during the night, but you'll be more conscious of it in the night, because imagine you have to get up to pee like 5 times. There's that feeling that something is really wrong. But during the day, because you're going about your activities, you might not notice if you pee 6 or 7 times. You might just notice that my frequency has increased. But at night it will be so disturbing, because you have to get up maybe after every 1 hour or 2 hours to go and urinate, and that is a warning sign that something is not right. And then because you're urinating a lot, because you're losing a lot of water, the next thing you're going to feel is thirst. You're going to be very thirsty. You're going to want to drink a lot of water, which is normal because you're peeing a lot. The next thing is that you're going to be very hungry, and this is explained because it's true, you're eating, but the sugar is remaining in your blood instead of going to your cells. So the hunger comes mainly because your cells, the real people that need the food are hungry, because the food is staying where it's not supposed to stay, and so where the food is supposed to go is not reaching there. So you always have that sensation of you're hungry, because there's some kind of hunger in your cells also. So you're going to feel constantly hungry. And then some people will lose weight unintentionally. You notice that you're just losing weight, and then you also feel tired. Those are usually warning signs that you should go to the hospital for your blood sugar to be checked. Now, the last thing I'll just mention in passing is complications, because the complications of diabetes are really, it's a whole large topic on its own, and this is really the most important thing about diabetes, these complications. Now, it's worth noting that diabetes is one of the leading causes of leg amputations after road traffic accidents. That means, apart from accidents, the next thing that will make your leg to probably be amputated is if you're diabetic. Why? Because one of the complications of diabetes is that your wounds will not heal. Normally, you can have a little scratch. If you're not diabetic, it will take 4 or 3 days for it to get healed. But if you're diabetic, it's going to stay there and not get healed. And as it stays, it's going to turn into an ulcer. The ulcer is going to become complicated, infected, and the next thing is that they'll probably say they have to amputate your limb so that the infection does not spread through your body. That's just one of the complications. The next thing is that you can also have some sensations, because diabetes also comes with nerve damage, and then there's no blood supply to your limbs, to your legs. Another thing too is kidney issues. You might have some kidney failures, because diabetes, one of the complications that we are most afraid of is kidney failure with diabetes. There's also blindness, and then there's also strokes that can be caused by diabetes. So I've just cited the complications, but hopefully we'll have another video where we'll explain more about the complications. So this is just what I wanted us to know about diabetes. I hope you have learned something. So in summary, I spoke about what diabetes is, which is the accumulation of sugar in the blood instead of going to the cells. I spoke about the two types of diabetes, or the three types, but we're mostly focused on type 1 diabetes, type 2 diabetes, and then there's also gestational diabetes. And I explained that this guy in the body called insulin, who normally is like the key that opens the door, but insulin can either be so little produced, or it can be excessive, or it can be produced normally, but your cells are no longer sensitive to insulin. And then I spoke about the complications. I know that diabetes is really common now. So with this information, hopefully you can start to think about your lifestyle choices. If you're drinking a lot of alcohol, you might want to reduce on your alcohol consumption. You might want to get physically active. Physical activity has been known to help a lot with a lot of diseases. It has been helped to also increase mental health. So apart from the fact that maybe you're trying to not be obese, you can also do exercises to increase your mental health, increase the flow of blood to your brain, increase the way you breathe. It also helps with tiredness. Sometimes people are just tired, but when you start to do physical activity, you realize that you're rejuvenated, you have energy. And then dieting, it's important to know what you eat. It's important to be intentional about what you're eating, because your body is what gives you license to stay here on earth. No matter the important thing that you're doing, if you're dead, you'll not be able to do it. And it's your body that gives you that license to be able to stay here and do what you're doing. So it's important to keep the body healthy. That's why it's important to eat healthy. Some people are like, okay, I'll not have diabetes because maybe I'm not obese. No, you should take care of your diet. You should take care of what you're eating. What goes into your mouth is what keeps your body healthy and what keeps your body fit. So I hope we learned something. I hope you learned something. I hope this made a difference somehow. I'll also be waiting on your comments. I'm sure there are people who have parents living with diabetes. Hopefully, parents or siblings or cousins or aunties. Personally, I have an auntie who has been living with diabetes for more than 20 years, but she has been very regular. She takes her treatment, she goes for checkups. So she's really not had any of those complications. She just had some eye issues, but not serious. And if she has lived with it for 20 years, so if you have relatives or someone who is diabetic, you can put that in the comment section. Hopefully we'll have another video, maybe with another doctor, to just explain how to live with diabetes and to live well and avoid complications. Okay, thank you very much for everyone who has listened, everyone who has given comments, everyone who has given positive and negative comments, which is making us to find ways to become better. And of course, I'm looking forward to your comments. I'm looking forward to your comments, what you learn, what you would like to learn, what you think that we can improve and do better. Okay, thank you very much.